Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Ilham Argansah and I'm from Pekanbaru. First, I will explain to you about overview the drugs addiction. Drug addiction, also called substance use disorder, is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medication. Substances such as alcohol, marijuana, and nicotine also are considered drugs. When you are addicted, you might continue using the drug despite the harm it causes. Drug addiction can start with experimental use of recreational drugs in social situations. And for some people, the drug use becomes more frequent. For others, particularly with opioid, drugs addiction begins with exposure to prescribed medications or receiving medications from a friend or relative who has been prescribed the medication. The risk of addiction and how fast you become addicted varies by drug. Some drugs, such as opioid painkillers, have a higher risk and cause addiction more quickly than others. As time passes, you might need larger doses of the drug to get high. Soon, you might need the drug just to feel good. As your drug use increases, you might find that it's increasingly difficult to go without the drug. Attempts to stop drug use might cause intense craving and make you feel physically ill. Withdrawal symptoms. You might need help from your doctor, family, friend, support group, or an organized treatment program to overcome your drug addiction and stay drug free. Uh, I will explain why recognizing an unhealthy drug use in family member is so important for us. Sometimes it's difficult to distinguish normal teenagers, teenage moodiness or angst from sign of drug use. Possible indication that your teenager or other family member is using drug include first, problems at school or work. Frequently missing school or work, a student disinterest in school activities or work, or a drop in grades or work performance. And second, physical health issue, lack of energy and motivation, weight loss or gain, or red eyes, and third, neglected appearances, lack of interest in clothing, grooming, or looks. And fourth, change in behavior, exaggerated effort to bar family members from entering his or her room or being secretive about where he or she goes with friends, or drastic change in behavior and in relationship with family and friends. And five, money issue, sudden requests for money without a reasonable explanation, or your discovery that money is missing or has been stolen of, or that item have disappeared from your home, indicating maybe there are being sold to support drug use. And third, uh, recognize and third, staging and intervention. People struggling with addiction usually think that their drug use is problematic and are reluctant to seek treatment. An intervention presents a loved one with a structured opportunity to make change before things get even worse and can motivate someone to seek or accept help, to seek or accept help. and intervention should be careful, planned, and might be done by family and friends in consultation with a doctor or professional, such as a licensed alcohol and drug counselor, or directed by an intervention professional. It involves family and friends, and sometimes co-worker, clergy, or other who care about the person struggling with addiction. During the intervention, these people gather together to have a direct, head-to-head conversation with the person about the consequence of addiction and ask him or her to accept treatment. And the prevention. The best way to prevent an addiction to a drug is not to take the drug at all. If your doctor prescribes a drug with the potential for addiction, use care when taking the drug and follow the instructions provided by your doctor. Doctors should prescribe these medications at safe doses and amounts and monitor their use so that you are not given too great a dose or for too long a time. If you feel you need to take more than the prescribed doses of medication, talk to your doctor. Preventing drug misuse in children and teenagers. Take this step to help prevent drug misuse in your children and teenagers. One, and communicate. Talk to your children about the risk of drugs use and misuse. And two, listen. Be a good listener when your children talk about peer pressure, and be supportive of their effort to resist it. And three, set a good example. Don't misuse alcohol or addictive drugs. Children of parents who misuse drugs are at greater risk of drug addiction. Okay, and finally, you will know preventing relapse. Once you have been addicted to a drug, you are at high risk of falling back into a pattern of addiction. If you do start using the drug, it's likely you will lose control over its use again, even if you have had treatment and you have not used the drug for some times. On one, stick with your treatment plan. Monitor your cravings. It might seem like you've recovered and you don't need to keep taking steps to stay drug free, but your chance of staying drug free will be much higher if you continue seeing your therapist or counselor, going to support group meeting and taking prescribed medication. And two, avoid high risk situation. Don't go back to the neighborhood where you use it to get your drugs, and stay away from your old drug crowd. And three, get help immediately if you use the drug again. If you start using the drug again, talk to your doctor, your mental health professional, or someone else who can help you right away. Okay, thank you for your listening. My altitudes we have shared be beneficially for all of us. Thank you. Assalamualaikum warahmatullahi wabarakatuh.